Hello and welcome to today's webinar session for the Level 5. We'll be discussing child development. So my name is Laura Sykes.
And my name's Gemma Carr. So today we're going to be discussing a few different topics. So we're going to be talking about the individual child's development, factors that can impact this, which would include transitions, the home learning environment, individual needs and their development, formative and summative assessments and how these can be used, and then we'll be talking about theories of attachment as well. So starting us off, we're kind of talking about holistic development, thinking about child development. So one thing to kind of be clear about here is this qualification is talking about from conception to 8-year-old. So talking about how pre-birth can affect the child's development and some things, or even the birth experience can be a factor that can affect the child's development or have an impact on that. So that could be whether a child is premature. Likelihood is that they may be slightly behind with their holistic development throughout their life, really, especially throughout their early years, especially until they're 8 years old. Obviously we're going to be this is going to also be linking through into the EYFS as well, and the curriculums that we're using. So Laura, can you think of any other sort of potentially sort of birth experience or anything like that might impact on the child's development?
Yes, as you said, kind of there's obviously that premature kind of birth, but there's also other things. It could be a traumatic birth. That can absolutely have an impact, because then sometimes they're not able to have that skin-to-skin contact straight away, and they've got to be taken off to receive treatment straight away. So it is important that we're aware of that birthing experience. Of course, we don't want to be asking too much detail, but we do need to know enough that if that is going to have had an impact for whatever reason, and even things like medical conditions and things like that can have a bit of an impact for the mother, but as well as kind of for the child during that time. That can have a bit of an impact on, I guess, the start of their kind of development, really.
So we're talking about the holistic development of a child, again thinking about how all of those areas interlink. We're not going to touch on that too much, because obviously that's something we should all still already be confident on kind of what that holistic development looks like and looking at the whole child, but also being very aware of stage and rate of development, which often can get forgotten. I think sometimes you can get quite bogged down into the EYFS and the tick box process in inverted commas that it can be seen as, and actually, but looking at the whole child, how are they getting on? So I think it's important to kind of be aware of the rates that children are developing might all be completely different.
Absolutely, and that's why it's really important we look at holistic child development. We look at the individual child, because as I said, they might be behind in physical development, but actually in terms of social development they're ahead. And quite often children will catch up with the support that's put in place, and so it is really important, like you say, to not get too hung up on the areas, like say within the EYFS, or they should be doing this. That is there as a guide, and every child will kind of develop at their own rate, and so it's just about us being able to pick that up. How do we support them? How do we support the parents to kind of reach those next steps? But those next steps will be different for every child.
And obviously all of that will change as they progress through nursery as well. So what you're focusing on in the baby room, you'll be looking at sort of the brain development, speech language communication, physical development, and personal social a little bit more in baby room. Whereas when you're coming up into the preschool room, you're going to be focusing more into your literacy, numeracy, hoping that those primary foundations are already there. And you're kind of just expanding on those. So being conscious of what's age appropriate, but also taking into factor what we've already spoken about, those birth experiences, and how those could be reasoning for when they get to preschool they're still struggling with certain things, whether that's personal, social, or speech language communication. Kind of putting those two and two things together, finding out that information from the parents and being confident with anything previously that could be affecting that development.
Yeah, absolutely, fantastic. So that takes us on quite nicely, actually, to factors impacting on child development. So, of course, we've already spoken about pregnancy and birth, so those kind of experiences there. Medical conditions we've touched on, but there's also kind of some other factors that could have an impact on child development. And again, it's about us getting that information from the parents, from the families when they start in the setting, so that we know enough, but again, are not prying. So it's trying to find that balance, really. But things like poverty and social disadvantage, that could have an impact on child development.
Yeah, definitely. That's something that can be, you know, think of it. Imagine, I always think of a situation where you've got family of 4 living in 1-bedroom flat, 4 stories up.
Yeah.
There isn't going to be an outdoor space that they have always got access to, you know, open the back door whilst mum's cooking tea or something like that. That's not going to be available to them. So being aware of what that environment is for them, and thinking that if there is 4 of them living in a house, they're going to be cramped, there may be more screen time, there may be less physical activities, because they just don't have the environment, the space for that. Or it could even be that with you know, with sort of social disadvantages or poverty, it could be a case that they don't have in the local area the places to take the children, even, you know, they don't have the classes, they don't have the groups, or they don't have the finances personally to take the child to the groups. So being aware of what is in your area for everybody. So, you know, there could well be a play cafe down the road, but that might not be appropriate for some families. But actually, you know of a free class that's run out of the local village hall or whatever, that anyone can turn up to as long as you put your name on the list. So being aware of what is local to you, so that you can impart that knowledge to help that child's development, and those things can happen outside of nursery.
Absolutely. And, you know, we're kind of, like you say, kind of touching there on poverty, on finances, you know, things like you know, being able to buy healthy food, you know, things like that I know we've spoken about before, can of course impact on child development, and being able to know the kind of, I guess, background to the families that are working, that are in our settings that we're working in, so we know what information, advice and guidance to give them, what you know, food banks are in the local area that are we aware of, you know, all of that is really important, and of course could then contribute to that impact on child development, and it also links that parents and home environment. You're speaking about that environment that is created, the parenting styles, you know, all of that can have a massive impact, as well as personality and temperament. And I feel like that could be parents and the family as well as the child there, and the impact that has on their development.
I think going on from kind of thinking about socioeconomics, that parenting styles is irrelevant of that, I think, isn't it? That is got nothing to do with your socioeconomic group or anything. That is the way parents parent is up to them. Yeah, we can support them with certain tools, tactics, things like that, but essentially they're going to do what they're going to do. But that, and again, that personality, that temperament of the child, sometimes that is either a learnt behaviour, or it could be something that's just them, and they're kind of, you need to tailor your style of working with parents and the child. Also thinking personality and temperament, we're thinking the parents' personality and temperament as well, how you're addressing these factors with the parents. If you have an issue with the child's development, or you think they're a little bit behind with speech language, you know, or something's become an issue, how are you going to broach that with the parent also is kind of to be aware of, and how you can kind of support that best for the child and still keep a good, that parent partnership appropriate as well, isn't it?
Absolutely. And I think within that senior practitioner role, this is something you've got to think about. You think about it in terms of managing the team and the different personalities that are there, and how you get the best out of your team. It's very similar with parents, I think. You know, when you're working with them, how can you get the best out of them? How can you get them on side to ultimately do the best for the child? You know, get support in place, whatever that might look like. So, you know, it is a bit of a learning curve, I think, as a senior practitioner, as a manager, somebody who is going to be working with parents to try and, I guess, reduce these impacts on child development, so that children get the best start in life, really.
Exactly.
So it also kind of takes us on a little bit around transitions and ACEs, so adverse childhood experiences as well. Of course, they can have a big impact as well.
Yeah, so I think the important thing is you know, we know what transitions are at this point. You know, at a level 5 qualification, you're aware of what transitions are. We've put a few examples here for you, but none of these should be a shock to you. But what we kind of want to talk about is how we are supporting these and what we can do to support these and what can be done in setting to support these. And again, there's going to be a lot of partnership working within transitions, as we know. But Laura, can you kind of give me some examples of how you can work with parents, work with children to support these transitions?
Yeah, absolutely. So like I said, it is all about that partnership working, communication. When I was working in a setting, I did deal with a couple of children, unfortunately, that did go through bereavement. And it was really challenging for the child, for the family, knowing how to deal with it, as well as for the practitioners, because it was a family that the setting had known for a long time. They'd had older siblings, and it is a really difficult time, and you know, quite often children can regress in terms of development, because they're going through such complex emotions, you know, particularly if it is a key family member. This unfortunately was a mother, and so, you know, was massive for them. So it was about talking to the family, you know, how they wanted to say what had happened. So I think terminology is really important. You know, were they saying heaven? Were they saying in the clouds? You know, what terminology are they using, so that the child doesn't get confused through that transition? So yeah, working very closely. We also reached out to a couple of organisations that actually support with bereavement. So that's the other thing, is there are a lot of charities out there that, you know, can support a lot of these transitions, where you can get advice and guidance on how to support a child go through bereavement. And you know, I've heard of the term puddle jumping. I don't know if that's something you've heard of. And it is kind of that, you know, just because you're supporting a child through that bereavement, they'll be jumping in and out of these puddles for a while. You know, just as you might think they're okay, that emotion might come back. It might be someone's their birthday or Mother's Day or whatever it might be. And it is about that long-term support. So I think it's not thinking, oh, there's this transition, it's coming up, we've supported it, that's it. If it's a lifelong transition, we need to be thinking about how we're supporting them long term, you know, throughout the time they're with us, and then of course how we share that information with the schools.
Absolutely. In that situation, Laura, how did you support the team to know what was happening and to know how to manage, in inverted commas, that child as well?
Yeah, so it was a really challenging time. You know, we spoke to, when we first found out and kind of we were informed by the father, it was having one-to-one kind of meetings with team members that had been there a long time, and so knew the older siblings and, you know, the key person in particular, because they'd had the same key person for all their children. So it was just kind of having those one-to-one meetings, offering reassurance, but also giving them that time. So we had a very supportive management team, which was fantastic, that would come into the room and cover if said, look, this person needs a minute just to process that, so that there was that kind of support. And then again, it was in things like team meetings. We had a play therapist come in and kind of having them talk to us, but also working with the child. It is just talking, I think, talk about those emotions, how you're feeling, and then come up with a plan together. You know, how are we going to support this child? And there were people that didn't feel comfortable to do that, and so, you know, they kind of backed away a little bit, which was okay, because there was enough people that could. So I think it's respecting that within your team. If it is a topic that is maybe sensitive to them because their own personal experiences, as a manager, you've got to think about your team as well as the child, the family, if it is something like that, you know, quite a complex situation.
How was the child sort of within the room? Were they did they regress? Did they have sort of any of these signs and symptoms that we talk about? Did they do the puddle jumping, things like that?
So yeah, definitely the puddle jumping. 1 minute would be okay, it like saying inverted commas almost, and the next minute would be very emotional for what would feel like for no reason at all. But of course there was a lot of complex emotions going on. after a period of time, we started to see some unwanted behaviour as well. That started to come out, and it was just about putting strategies in place to manage that behaviour and talk about those emotions. But yeah, absolutely, you could see almost a confusion within. It's a 3-year-old that kind of, mummy was there and now mummy's not, knew that mummy had gone to hospital, and so kind of, I'm sure, left lots of kind of unanswered questions that you can't vocalize. So very, very challenging, but definitely I could see in emotion, that management of emotions and behavior were kind of the key kind of factors afterwards, and it was trying to manage that so that it didn't have too much of an impact on development. But of course, it naturally did have an impact. You would expect it to, and it's just, we can't eliminate all of those impacts. We can just try to reduce them as much as we can, and I guess support the child to build up that resilience a little bit, to kind of, when things do happen, when bad things happen, how do we overcome that?
That's a very we've spoken a lot on that with emotions and kind of the importance of teaching children about emotions and understanding their emotions, and understanding it's okay to have these big emotions, no matter what the circumstance, whether that's just moving, think of transition from moving inside to outside, or death of a family member. Understanding what these emotions are, I think that's a very important example of showing why it's so good to have those conversations with the children, and kind of knowing that. So I also like that you involved outside agencies and external support as well, because was that the only time you've ever experienced that in your career?
So I had done it, so that was the first time with bereavement, but of course with other transitions, we work with other professionals as well, and I think it's about knowing that. I think as a senior practitioner, as a manager, it's important to know the agencies in your local area, who you can contact for different scenarios, really. When it comes to supporting children to deal with, challenges, change, all of that can have an impact on a child's development. So it's important we know what is around us, what support is around us, because there is a lot there when you start to look into it, and I think it's really important to know that, to hopefully have a positive impact on that child's development overall.
And I think the most common transitions that most settings will experience will be the short-term transitions, won't they? Sort of the moving house, your daily transitions, going on holiday, those sorts of things. So thinking about the smaller transitions, maybe, what are some things that you would could do with children to kind of promote that, and or any resources that you might know of to support teams with going through these, because that sort of can happen at any time, can't they?
Absolutely, yeah. And I think it's time, the sooner we know that, I know there's a plan to move house, the sooner we can put things in place. You can do more role play, you can maybe have books about, moving house, birth of a sibling. So I think a lot of it is time. The more time we've got, the more you can help the family and the child to kind of prepare for that transition, so they kind of know what's coming, so you can try and put a positive spin on it where possible. Of course, it depends what the transition is, but I think there's so many lovely resources and activities you can do to support children, as well as that communication and letting them share those feelings, as you've already said, which is really, really important for children now, their development, and for the future.
One thing for me is I've had a situation before where the child was moving house, and one of the members of staff in the room, this was in a preschool room, one of the members of staff had a bad experience with moving house. So the member of staff then sort of was letting out her woes of moving house onto this child, which obviously, as we know, isn't great. But this member of staff was kind of talking about how, it's such a long process and everything's in a completely different place. I couldn't find anything. And, kind of those things that as an adult we'd go, oh, yeah, sure, kind of pass them off as a comment. A child can't do that. So we need to be aware that moving house needs to be made into a positive experience for the child. So we need to be excited about it. What's your bedroom look like? What colour is it going to be? What's going to be in your house? Are you going to take all your toys? Making sure your staff are confident to be positive about it and not inflicting your pain onto them when it comes to those transitions, or even going to the doctor. Oh yeah, well I went the other day and had an awful blood test and it really hurt. They stuck me with a needle. When actually that's probably not going to happen when they're going to the doctor. You know, just kind of being aware of how you're vocalizing your past with the children, and not giving those children the fear of those situations as well, isn't it?
Yeah, absolutely. And I think that's really important, because again, that could have an impact on their development, on how they see things, on their resilience, and how they deal with change. So yeah, I think you're right. I think it's really important for us as individuals to be aware of our own experiences and maybe our bias in moving house or whatever it might be, so that we then can take ourselves away from that situation and try and reflect. And I think that's about a team working together to do that as well. You know, in that senior role, you've got to support your team to know that. And it might be, you know, people might not realise they're doing it. You know, bring them away and say, look, do you realise that this could be the impact here? You know, we need to, you know, be positive. We need to be doing this. So it is really important. Although we want practitioners to share their experience with the children. You know, I've got a sister and I really like having a sister, for example. You know, we want to focus on those positives, maybe not those kind of negatives.
Exactly.
Fantastic, excellent. So the next thing we're going to talk about is that enabling home learning environment, and we've spoken a little about the impact of that already by talking about, you know, whether you've got a garden, you know, more that kind of physical kind of environment at home. And it's important we know what that is, because of course that enabling home learning environment will have an impact on a child's holistic development. You know, if they're getting that support for their next step in the setting and at home, the likelihood is they're going to achieve that next step sooner, quicker, more effectively maybe, because they have got that continued support. So Gemma, you know, what is the importance of creating that environment? Why is it important, do you think?
I think it's a lot of settings now kind of home from home almost vibe, aren't they? And it's kind of the child sort of still needs learning at home, and I think often that's forgotten. You know, some parents may feel, well, they go to nursery to do all their learning, but actually they are learning so much at home. So I think it's so important that we teach parents about that, and they understand that they are learning. And one thing I say to a lot of parents is, you know, if they're behind on communication and language, just narrate what you're doing. You know, talk about what, you know, I'm just going to go over here, we'll get the broccoli out for tea, and then we can go and do that. And then, you know, you're not expecting a response half the time. 3/4 of the time you're not expecting a response. But you're just narrating out that communication, just talking about it. And I think talking to parents about that, and kind of, but also at the same time, home is also home. It doesn't need to be a school environment. They don't need to be learning every single second of everything we're doing, but just being conscious of how we're talking to parents and how we're promoting it. So one thing that's quite good and can kind of be quite inclusive to everybody is whether you've kind of got a leaflets about sort of how we do things, kind of how you can promote an enabling environment at home. So a lot of parents don't like use of technology and tell their children they're not allowed to use technology, but actually will sit on their phone for half an hour whilst they're playing. The child's playing, but you're all sitting on your phone. So it's kind of being aware to parents, actually they're going to want to do that because that's what they're seeing from you. So kind of talking to the parents and saying, well, why don't you just sit in the role, you know, in your little corner where they've got their little kitchen, and do a little bit of role play with them, and spending that quality time with their children. It, you know, again, irrelevant of sort of a parenting style, irrelevant of socioeconomic groups. That is your space, just spending quality time with them in any way possible for however amount of time as they can, really, isn't it?
Absolutely. And I think, you know, it is that quality, not quantity. You know, is it reading a book before bed, whatever it might be, it is really important that there is that home learning, and that home learning will happen you know, just kind of quite naturally through whatever's going on at home. Do we want it to be enabling? Do we want it to be quality kind of interactions? Yes, absolutely, because it will have a more positive impact on child development if that home learning is there. So it is really important to, you know, within the senior practitioner role, within that managerial role, to think about how in your setting do you promote that enabling home learning environment. You know, do you speak to your parents? Do you have leaflets? Do you have activities that they can take? Do you speak to them about how, if they, you know, have that quality time and promote home learning, that will have an impact on their child's development, on them reaching their next steps? How do you do that, really?
I think it's also good to kind of make clear to parents, like in nurseries we do activities, don't we? You know, that's what we do.
Yeah.
That's how our brains work. We are constantly, if a child says, I went to the zoo, okay, great, let's do this. You know, that's what we do, isn't it? There isn't an expectation for parents to do that.
No.
There is no expectation. Of course, yes, lovely. If you want to do these activities, here could be a list of things to do. But actually, there is no expectation for parents to have to do activities at home. Just being with them, just playing with them, just spending that time with them, just having, like you say, story time, just having a natter, having tea with them, you know, having those conversations with children more often is important than anything in that home learning environment.
Absolutely. And it could be, you know, the garden. If you haven't got a garden, you go to the park and you play at the park. Like I say, it doesn't have to be a structured activity of making Play-Doh or anything like that that's going to have a cost implication, or you think, oh, I don't know how to do that. It is just that quality time, and it's whatever that looks like for that family, really. It can be so different depending on the family and kind of your background and the things that you enjoy. You know, that's the other side of it.
Yeah, exactly. You know, including that into your everyday as well. You know, going on a dog walk with the children instead of just taking the dog out before the children get up or something like that. You know, having them in that time with you.
Yeah, and I like what you said there about meal times, you know, sitting together, having that as a time to communicate and talk about what they're eating, how their day's been. You know, it is a really good kind of opportunity for that quality time for that home learning. And yeah, I think you're right. I think it's important for us to share with parents. It's not about activities or toys or resources. Of course, if you have got stuff, fantastic, but it is, you know, you are the greatest resource for your child as an adult, a parent, but also, you know, very similar for practitioners, you know, the greatest resource you've got in your setting to support that enabling environment. It's not just that physical element.
Exactly.
So that takes on quite nicely actually to the key person approach. As I've said, within your settings, you know, your key people are a very important part of that enabling environment. That enabling environment will support children with their support the children with their development, that holistic learning and development. So that key person approach, as we know, is in place within the EYFS, and it is to support the children to have that attachment. And they've got that one person that they can go to that is doing their care routines, maybe that is doing observation, assessment and planning, and is there just to kind of support the child as well as the parents and the family and help them to reach those next steps.
I think it's important. A lot of parents, you may say, oh, they're going to be the key person, and they go, okay, that's nice. We use language like this, knowing what all these words are.
Yeah.
But parents don't know this language, so it's so important for us to say to parents, this is going to be your child's key person. This is what their role is. They will be sending you this. We'll do your baseline assessments. We'll do this. You know, we'll do 2-year checks. All those things, you know, they'll be your port of call to nursery. Making that clear to the parents so that they actually know what the role of the key person is as well. Because, like I say, we use key person and go, yeah. And that just is, isn't it?
Yeah.
But actually break down what a key person is and be really aware of what that is. And do your parents actually know what a key person is, or is that just the person who takes your child at the door?
Yeah, absolutely. Are we aware of that early years jargon that we use? Because it is absolutely there. And it might be interesting, you know, to find out. Ask the question. Ask your parents if they know the role of a key person. Do they know the impact that key person has on your child's, you know, holistic development and their learning? You know, it might be an interesting question to ask and see what they come back with. You know, think about how do you share with your parents in the setting what that key person role is and what they do. I think it's a really good point.
So there are quite a few theorists behind attachments. And that's something that you're going to look at with your individual tutor as well. So kind of you'll look into that in more detail in your one-to-one sessions with your tutor as well. So those will be explored. But as always, please do that extra research, find out about those theorists, deep dive into them, find out why those attachments are important that bit more. Again, we have key persons because that's what it says in the UFS, but why? Why does it say that? Why are key persons so important to children? You know, understanding all of that basically. So we've got quite a few useful links here. So as always, we'll send out this PowerPoint as well. So we use these links. These are just a starting point. These are some of these that will kind of take you on to further research within them as well. There's a lot of articles on all of these websites. So researching these into a bit more detail, ready for your assignments, ready for your evidence collection, ready within this block.